Hi there, my name is Dr. Carlo Renato. I'm a chiropractor and PhD candidate in vestibular rehabilitation from Sydney, Australia. Well, hopefully by now you know that I'm heading up to Hong Kong August 4 and 5 to present probably one of my most favoured seminar, Managing the Cervicogenic Patient, a vestibular neurorehabilitation approach to managing patients with chronic muscular joint dysfunction, whiplash injuries, concussion, poor balance, cervicogenic dizziness. You're going to get a whole bunch of information that relates to managing many of your standard or even more complex cervical spine patients. Now, this seminar is not to take away from your current manual therapies, whether it be soft tissue, spinal adjustments, or anything else that you do in between, but really this is a way that we can look at the brain's involvement with cervicogenic disorders, as well as the spine's involvement with brain-based components as well. So we certainly are aware in practice that when someone has a neck that's not working well from degeneration, an injury, or a whiplash, how it affects their vision, their balance, their train of thought, brain fog, insomnia. We know the effects that has, and we know the benefit that chiropractic or physiotherapy or any other manual therapy can have on this. But can you explain it in a very contemporary, up-to-date way that looks at the neuroscience of that connection between the spine and the brain? And I'd say to you, if you can't, then you should. We need to move away from some of the outdated models of how chiropractic works. We know that it works. There's no doubting that. But let's pick up our game in terms of how we can communicate this better, more contemporary. There are many parts of the world now that are moving towards this, and my job is really to help as many more of these practitioners to become updated with these components. So I'm really looking forward to coming up, and we're going to have a blast over 1.5 days. So some of the topics that we're going to be covering is I'm going to start with some of the neurophysiology. I mean, we can't escape how areas of the body are connected. We're going to look at the neck and how the neck is related and connected to other parts of the brain. We need to stop thinking very linear. This is connected to that and that's it. There's a whole network of these neurons that connect to each other. And it's important that we understand where and how they do that. The cervical spine connects to many other areas. And so I'm going to bring you up to date with some of the science on that. We're going to look at what happens when something goes wrong and how that affects your patient's health and how we can explain it to your patients, medical practitioners, or anyone else in a very updated manner. We're going to spend a lot of time on the assessment and management of the cervical spine as it relates to a brain-based approach. In fact, majority of the time is going to be hands-on practical things, so be ready for that. We're going to talk about how the spine, particularly when it's injured from a whiplash, how that can look like a concussion. And I'm going to show you the overlap between those. And finally, we're going to talk about how you can apply this information very easily in your practice with some easy to use forms and some logical ways of approaching people with cervicogenic problems. So I mean, this is an overview, and you can see the list that I've got here. There's a lot we need to cover in those 11 to 12 hours. So we're going to talk about sensory motor aspects, so how the neck and brain connect to each other. We're going to talk about some more contemporary ways of how to assess mechanical aspects of the neck, but more in terms of control, not purely range of motion or orthopedic test, but more how the neck is controlled. We're going to look at how the neck and eye movements are connected and some really good tests that you can use there. We're going to look at balance. We're going to look at the vestibular system and other aspects that tie the neck with how the patient is performing or not performing. So this is a bit of a busy slide, and probably the most busy slide that I'm going to show you out of the whole weekend, but it's probably one of the most important. And it looks at how the cervical spine or afferents or information from the cervical spine connects with these other areas of the body. And it connects through pathways and reflexes. It connects to the eyes. It connects to the vestibular system. It connects to higher centers. It connects to posture and balance. It connects to limb movement. And it's not just purely, the C5 nerve goes to the arm and that's how we move our shoulder. There's a lot more detail to that. Now, this is not a detailed neuroanatomy lecture, but I do need to give you some of the basics that give you an understanding of what you're looking at, how to assess it, how to manage it, what to expect, and how to discuss this with people. And the area that I want to spend this video on is that sensory motor aspect. And we know that the cervical spine, the sensory information that comes from the spine, or the afferents that come from the cervical spine, gives the brain an understanding of where the head is in space, where the body is relative to the neck, and where the head is relative to the neck. It gives us an understanding of our eye movements, how do we coordinate our eyes, our inner ears, our vestibular system, how do we coordinate that with our posture? So when I turn my head or my head goes forwards and backwards, what corresponding postural change do we see? And as manual therapists, whether it be chiropractors or physiotherapists, the posture and spinal function is something that we see all the time. But we're going to tackle it from a more of a top-down approach, and we're going to explain that further. One of the areas that I probably like most and I get most feedback from, I've been teaching this for several years now, is really the proprioceptive component of the cervical spine. We know that the upper neck is enriched with proprioceptors, muscle spindles, more than any other part of the body. So when that goes awry through injury or whiplash or anything else, that information that goes back to the brain is not as clear as it should be. There's a mismatch. And so their head position or body position can be distorted as a result. So we talk about here how we can assess cervical joint proprioception. We're going to spend a lot of time on that, and we've got these charts that I'm going to bring up for you guys. I've got these head-mounted lasers that we're going to be using. It's a very contemporary way to look at joint dysfunction, and whether you want to describe it as a subluxation, whether you want to describe it as a joint position error, whether you want to describe it as anything else, that's for you to describe. Well, let's get objective with it. Let's do some pre and post. And this content will really give you that opportunity. We're going to talk about. I'm going to bring a whole bunch of these charts and lasers with me, so you guys can use them in practice as well as during the tutorial. We're going to look at the body awareness, head body awareness aspect. It's so important, and you'll love it in practice. Your patients will love it because they'll see feedback on how well they're going or how well they're not going, and how they're progressing over time. So you definitely don't want to miss this. So again, before I get on to the next topic, which I'll post very shortly, there's the information for you guys. I'll have a link down below. So August 4-5 in Hong Kong. We've only got limited space. We've already sold a handful of tickets, and I'm sure we're going to sell out before we get to early bird. Early bird closes the end of this month, end of June. Don't wait till then. We're selling them quickly. I would suggest you get onto this pretty quick because we've only got limited seats, and I certainly don't want you to miss out on this. What I believe to be probably the most important neurology-based seminar that chiropractors or physiotherapists can take. That's the response that I've had from many people that have taken it, both here in Australia and overseas, and I expect the same from Hong Kong as well. Look forward to seeing you soon, guys. Cheers. Bye for now.